During Tuesday's post-cabinet briefing, Minister for Implementation, the Honourable Emlyn Pear, outlined several benefits of the National Health Insurance (NHI). Minister Pear highlighted the fact that every Grenadian will be able to access any basic medical service once the NHI card is presented. Dr. Martin Francis says that NHI would allow doctors to detect diseases and other complaints sooner, as patients will now be able to complete tests and screenings that would have been inaccessible because of financial constraint.
In the practice of medicine in this country, generally people wait until they're unwell before they go to the physician. And even when they access care of the physician in the health centers or the medical stations, the physician will consult with them and give them a diagnosis and ask them to do some investigations. And in many instances, that's where it ends, because persons are not able to get those investigations because of the costs associated with it. And as such, being able to do the preventative care has an issue. So under the NHI, the matter of primary healthcare visits or the visits to the doctor in the primary healthcare setting will be something that would be easily accessible. And it will be preventative in the sense that doctors will now be able to do their annual investigations for patients without patients having to worry about where they're going to get the money to pay for these things. And so screening will become easier. Diseases would be caught very, very early because patients will now be able to access the investigative services that they need.
Dr. Francis says another service that will be made available on the NHI is acute psychological care.
Something else that would be available to us on the NHI that was not available before is something we call acute psychological care. Just recently, we've celebrated World Health Day where the topic was depression. Let's talk about it. In our society, there is not a whole lot of opportunities for people to get this acute psychological help, where people can get help for depression and stress-related conditions that could lead to suicide and all other sorts of things. And NHI provides for that opportunity. So for us, again, as physicians, this is highly, highly preventative.
Another proposal put forward under the NHI is that of rehabilitation service for people who would have suffered with a stroke.
One of the other things is rehabilitative care. As it is now, if someone has a stroke and goes to the hospital and get discharged home, when you get home with a stroke, there is really not a good support structure around you to help you to rehabilitate it and get the use of your limbs again. With NHI, we're proposing to offer that for patients as well, so that there could be good physiotherapy and massage therapies to help people. Again, once these service providers are registered with NHI, the population will be able to access that care.
Akeisha Felix for GBN News.